Hey everyone, Dr. Luke Peterson here, physical therapist with the Knee Replacement Therapist. In this episode of the Knee to Know Show, we're going to talk about stiff knee syndrome or frozen knee after knee replacement surgery. What are some of the potential causes for this, and what are the management and treatment strategies? Hey everyone, Luke here with the Knee Replacement Therapist. So today we're talking about stiff knee or tight knee, frozen knee, arthrofibrotic knee, excessive scar tissue after knee replacement surgery. So before we dig into that, be sure to hit that like button, subscribe if you don't already, so you can catch all our videos related to knee replacement, preparation, recovery, frequently asked questions. So let's dig into it. What are some of the potential causes for a stiff knee after knee replacement surgery? One of those knees that you can't bend, can't get any range of motion back, just feels stiff, tight, painful all the time. So probably the most common and the most likely cause is scar tissue formation. Now, scar tissue formation within your knee joint is a normal, common procedure supposed to happen after you have a surgery or any type of trauma to your knee or any part of your body. And what happens is there's the phases of healing. So in the first phase of healing, this is maybe that first couple of weeks, is when your body is just trying to recover, trying to bring nutrients, bring the right things, the right cells, the right collagen and soft tissue, and bring everything to that area. And then after that phase is what's called the remodeling phase, the last phase of surgery, of healing, and where your body starts to lay down that scar tissue starts to get aligned, it starts to get remodeled and positioned how it's going to be and how it's going to stay essentially for the long term, and laying down all that cartilage. And what happens sometimes for a variety of reasons is that scar tissue formation within the knee joint occurs faster than you're able to restore your range of motion and regain your range of motion after surgery. This might be because of pain, uncontrolled pain. This may be because of inability to get into physical therapy right away, or to get in with doing your exercises and range of motion exercises right away in that same day and first few days or weeks after knee replacement surgery. It may be just because of the biology and physiology of your body is unfortunately lays down scar tissue very quickly and in a very high level, greater than most normal people. And so it might not even be, in most cases, it's not even due to something because of you. It's just because your body lays down that scar tissue so fast, and you're going to have issues with range of motion and mobility. So that's probably the number one cause for having that stiff knee syndrome after knee replacement. There are some other causes. Potentially you could have a bleed into your knee joint. You can also get an infection, is a very common cause for having a stiff knee and problems with range of motion. And the other one is just a poor fit and incorrect size of the components of your knee replacement. So those are things that obviously you need to consult with your surgeon. You need to rule those out as potential causes of having these issues. And I would also say that it's common for everyone to have stiffness and tightness and difficulty restoring range of motion after surgery. It's very common. What we're looking at is if you're someone who, you're weeks out, months out from surgery, and you're not really meeting these benchmarks, you're not progressing with your range of motion appropriately, that's more serious, something we have to look into more. But everyone's going to have some stiffness and problems early on with surgery, after surgery. So what is the treatment for this issue? So the first number one thing is physical therapy, extensive physical therapy. It's conservative treatment. It's non-invasive, working on that range of motion, working on the bending, working on the straightening consistently, multiple repetitions, multiple long duration, lots of time doing these exercises, trying to improve that range of motion just through exercises, movement, physical therapy techniques. So that's number one, first off. If that doesn't seem to be helping, if you're not improving that knee range of motion, decreasing that stiffness, the next thing is to look at different equipment, different devices that are out there and that are available. So for example, there's devices that help with straightening of the knee, there's devices that help with bending of the knee, and basically you just sit in those devices for a prolonged time, getting that prolonged knee straightening or knee bending stretch to improve that range of motion and get to a point that is appropriate for where you are from having knee replacement surgery. If that doesn't seem to be effective, the third thing would be looking into a manipulation under anesthesia, or an MUA. And basically what this is you are put under anesthesia. It's a surgical procedure. So you're put under an anesthesia, you're asleep, and the surgeon is going to go in and perform range of motion and manipulations to your knee joint to break up that scar tissue, break up those adhesions, and get the maximum amount of range of motion that they can get while you're asleep and under the anesthesia. And then after you come out of that anesthesia, you have, again, extensive physical therapy. A lot of people, most of the time, you get good improvements in your range of motion, and then you have to carry that over with physical therapy and exercises to maintain and continue to improve that range of motion after having the procedure done. So that's the next option, is an MUA, or manipulation under anesthesia. The fourth option is going to then be starting to look at surgical options. So if none of the things previously have had any benefit, haven't improved your range of motion, you're still having stiffness, pain, unable to bend the knee or straighten the knee adequately, then you're going to look at some surgical options. So the first thing would just be going in arthroscopic surgery to remove and break up that scar tissue surgically. So that would be the first option. Go in arthroscopic surgery, break up that scar tissue, debride, remove any of the scar tissue that you can, and then again, we go back to extensive physical therapy afterwards to get as much range of motion back now that that scar tissue is broken up as much as possible through the surgery. The next possible thing to do surgically would be to change the components. So change the prosthetic components that you received, or considered more likely as a revision knee replacement surgery. So this is your last resort. This is nothing else previously that I've talked about has worked. Going in, getting a revision knee replacement, they're going to break up all that scar tissue. They're going to adjust the fit of the prosthetic components if possible, making something smaller, checking the fit of the soft tissue, the bones, everything, and checking that range of motion, of course, as they do the surgery and as you're under the anesthesia and in the surgical area. And that's kind of that last choice and that last option, if nothing previously has worked, is a revision knee replacement surgery. So that's the potential causes and the potential management strategies of a stiff, tight knee after knee replacement surgery. Again, don't go rushing to your surgeon if you're a few weeks out from surgery and your knee feels stiff and painful. That's common, that's normal. It's going to take time to heal and restore that range of motion. This is for someone who really hasn't been progressing with their range of motion, hasn't been meeting the appropriate benchmarks, and is just having significant difficulty and significant problems with restoring adequate range of motion after knee replacement surgery. Again, I appreciate you all. Please like, please subscribe, turn on those notifications so you can catch all of our newest videos. I post regularly everything related to knee replacement, preparation, recovery, the surgery itself, frequently asked questions, and everything else in between. Thank you very much for watching, everyone.